Function with Purpose podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to the Function with Purpose podcast, Season 3, Episode 1. Today's topic, wanted to discuss some things that typically physical therapy will assess, and then hybriding that, some things that can be carried over within the gym. So, knowing the difference between body or movement imbalances versus asymmetries. So some definitions that I want to make clear based from my thought dots is imbalances. Imbalances, thinking of this way, when we're in the gym, does your bench press strength match your ability to perform a power clean strength movement? So imbalances equal to absolute strength balance, meaning your ability to perform the most absolute movement or absolute strength within that movement pattern. So in that example, a bench press, how much can you lift perhaps for a 1 rep max versus how much you can lift in a power clean for a 1 rep max. So are those two lifts pretty symmetrical and balanced with each other? Now, I haven't dug in super deep on, how much should the percentage of the power clean be relative to your bench press, etc. Personally, that's something I have to dig in a little bit more, but you probably want to see those numbers fairly decently close to each other. I'll use myself for an example. It's been a while since I've tested my bench press as well as power clean, but last number that I can recall for my 1 rep max bench press was 150 pounds. And my 1 rep power clean is 155. So that's pretty close. Based on that absolute strength portion, for me, I'm fairly balanced. So I'm strong in each of those positions. So a bench press or a pushing motion versus a power clean, which is a hinging motion, hinging or pulling motion. So I'm pulling that weight from the floor. Another example for making sure things are balanced with our absolute strength is our squat versus a weighted strict pull-up. So I'll use my example. The last time I retested my 1 RM squat was a little while back, but I hit 215 pounds. And my latest 1 rep max weighted strict pull-up was my body weight, which is about 135, 140 pounds plus 50 pounds. So almost 200-ish. So it's fairly symmetrical, fairly balanced. So then this leads us into what are asymmetries. So from a physical therapy perspective, focusing on the little movements, the quality of movement, the positioning with perhaps the bench press or perhaps the squat. So asymmetries, in my definition, is performing that specific lift or movement that is even from side to side. So right versus left. So we will use the bench press for an example. When you're performing the bench press, does one arm push a little bit more than the other, therefore creating asymmetry in that bar path, meaning that bar does not stay parallel to the floor or perpendicular to the floor when you're pressing it or lowering it. So there's some type of asymmetry that's going on into the shoulder complex or perhaps even the core. Another example is pertaining to the squat, the back squat. So when you're performing your squat, do you feel and do you see your knees or one knee caving inwards and the other one is like straight path solid? So that is an asymmetry. There's some type of asymmetrical pattern that's going on, thus creating these imbalances with your absolute strength movements, i.e., the bench press or the squat. So that's where physical therapy comes in. So when I see my patients, I take them through a little bit of a screening once we are able to grab a hold of and take control of pain, because that's usually when patients come in and see me, they have pain, and that pain is affecting their bench press, perhaps. Well, we go ahead and assess their bench press once they're pretty much pain free and they can control that pain and not experience it as much or as often, and we assess their bench press. So that will give the patient data and information that there's probably most likely an asymmetry that's going on. In addition, from the physical therapy perspective, when when patients do get to that point where they want to improve a specific lift or movement or just be better all fit and improve their movement quality, I take them through an assessment called the Functional Movement System Assessment. I'm not sponsored by them, but I am certified. So in short, it's called FMS. And it was developed by a physical therapist named Gray Cook. And it's about 7 or 8 different movement patterns that I take the patient and athlete through. And that provides us with data. Yeah, it's based on a scoring system, but it helps us gather this information to see if there's any asymmetries going on. Are there any imbalances that could be revealed? Imbalances, i.e., when I do take them through a bench press or a squat, or have the patient video themselves for that particular movement if I'm not able to be there in that point of view. And also the FMS provides us with little faulty movement patterns that the patient or athlete will eventually have to work on. So that's where the physical therapy comes in, to help bridge that gap into the fitness world and wellness world, to help create symmetry and absolute strength balance within basic human movement. So knowing the difference between body imbalances versus asymmetries. Quick review. Imbalances, this is my definition, is having that weakness of the balances. So a prime example, like I discussed earlier, is, does your bench press absolute strength match your ability to perform perhaps a power clean or squat clean, 1 RM? Are those numbers that you hit fairly balanced, one versus the other? And another prime example is a squatting pattern, a back squat or front squat, versus a pulling pattern, a strict weighted pull-up. Are those balanced out? So think of imbalances as an absolute strength, which whatever movement, maybe it's a AMRAP, as many rounds and reps as possible, or as many reps as possible for a push-up, versus your ability to perform kettlebell swings, your capacity. And then on the flip side, asymmetries. So when you're performing that particular movement or lift, does one side feel more off than the other? Prime example is during the squat or deadlift. Does one knee cave in as you're performing that movement and the other one doesn't? So that gives you data that, okay, the knee that's caving in, that's probably a lot of stuff that's controlled from the core and hip, as opposed to the other leg where that hip and perhaps some of that core crosstalk is pretty symmetrical on that side. So that's where physical therapy comes in. We have that outside perspective to help create that symmetrical movement pattern, which then carries over to your balanced strength portions within the gym or within life pursuits. So if you're in the South Charlotte area or in the Charlotte, North Carolina area, and you want to get an assessment done, definitely hit me up, Fortress Physical Therapy. If you're looking for some remote training or wellness assessment, definitely I can help you. You don't have to be in Charlotte, North Carolina. But remember, the body is always going to find out and know the path of least resistance in order to get the job done. So why not help fix those asymmetries and imbalances so you can be overall more strong, more methodical, more flexible, and then in turn, living more days without pain than in pain. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.